Hi, I'm Jason Greenwood. I'm a general dental practitioner. I'm based in Stafford in the West Midlands. The edelweiss system itself is very well thought out. All components complement each other very, very nicely indeed. There don't seem to be any blanks that I've been able to find yet. Within the realms of what they do, it's complete. For example, the composites bond beautifully to the glass veneers. You don't get an interface stain line. The bonding technology is absolutely spot on, and you end up with a very nice result. A misconception of the edelweiss direct veneer system is that it's composite based. The actual material is a vitrified barium glass. Compared with composite, edelweiss maintains its luster. We have cases that are 10 years old that look just as good as when they were placed. You use a normal composite, one of the biggest issues can be the loss of the luster, or even surface discoloration being attracted by the surface roughness. These problems are avoided, of course, when you're using a glass layer. As we all know, when using day-to-day ceramics, stains do not like to stick to the material. In fact, teeth tend to attract stains more than this material, which gives you a big head start. The luster, the translucency are very good at picking up the composite material that you place with. So masking layers is down to the material that you use and the quality of the composite that you use. Edelweiss's own nano hybrid composite is very well matched to the system. The bond system they provide is for inorganic only, and I've never seen a join line between the composite and the veneer. The enamel-like translucency of the veneer really draw this colour out and give it a lovely deep luster and some good translucency, which can be the biggest bugbear when selecting a correct shade for your patient. The big thing for me when doing an indirect restoration is the translucency. It's like banging your head against a brick wall sometimes, that communication to get the thing looking natural. It isn't always about the shade, but wow, the translucency, if that's wrong, the entire thing looks disastrous. With edelweiss, they are basically supplying your enamel layer. The dentine layer and the characterization come from you and your use of the composite bonding material. Even down to blocking a dark underlying tooth, which is the worst thing that you can ever try to cover. If you're using a very opaque composite, you can use that and it'll obstruct the colour so it looks natural, but you still have the enamel, natural looking layer of the veneer itself to give you that three-dimensional luster. What's wonderful about the veneers themselves is that you can push very firmly on them without worrying about them breaking, which I've not come across any other veneer system of this quality that can do that. And remember, it's not a composite veneer, it is glass. Sizing for your edelweiss veneer is really simple. Acetate strips, patient, and what you do is you hold it across the patient, and very clearly you can see the size of the restoration required. This is disposable and readily available from edelweiss, single use per patient, very, very, very easy to use, and cover sizes from second premolar to second premolar, upper teeth and lower teeth. Long neck, just incorporate where there's some gum recession and you just need that little bit of extra coverage and want to avoid a composite interface. Similar to sizing for the anterior veneer, for a posterior occlusal form, acetate strips also to place over the tooth you will be restoring. Exactly the same idea, left, right, upper and lower, all are available. You can even do this for pediatric crowns. Occlusion VD is an occlusal anatomical form. You size it using the acetate strips. Once you have selected the shape, you will check for clearance. You'll fit it again, just like the anterior veneers, using composite, using the veneer bond material. What you can do is cut down and shape the occlusion form to suit the appropriate part of the tooth if you're not doing entire coverage. You can also adjust the anatomical form. They come provided in a very juvenile, unworn format. What you can do is polish it to add the wear and tear of a lifetime without fear of perforation. You can characterize beneath it, you can add stains, you can add characterization to any level that you wish. And the lust of the vitality is just like that of a natural tooth. Pediatric crowns are a bit of a dark art, I've found. You have the normal stainless steel crown forms. It can be traumatic for the patient. It can be very user sensitive. I know a lot of dentists don't enjoy using it. And of course the child ends up with a silver tooth. That doesn't always go down very well. With the pediatric crowns, you're getting an extremely good anatomical form, and you're bonding it using technology that we're using every single day and are happy with.